Morning. So today we're going to be looking at the eclectic and integrative approaches. So the second half. The core theories in eclectic and integrative approaches we've actually addressed, which is person-centered and psychodynamic, are the two theories we use here at the college within the integrative approach. So what I'm going to be talking about today is really looking at some of the differences between eclectic and integrative, and what is integration about, rather than the theories. Okay. Within integrative therapy, you're using different theories, and it's how you go about integrating them, which is what the whole process of the integrative module is about, and the pathways. How do you go about integrating? Are you going to be working as an eclectic therapist or an integrative therapist? Because they're separate elements. Okay, so what I'm presenting are models of integration, which is what you need to understand, within which you use models of understanding people, either psychodynamic, person-centered, CBT, Egan, skilled helper, depending on where you're coming from. There's a variety of models that you would use within integrative. So integrative in and of itself exists as a theory on a theory. Okay, it's talking about how do you integrate different theories. It's a theory about the theories. You get that? Okay, it's what is otherwise referred to as a meta theory in that sense. Okay, so when you think of this, integrative and eclectic, what comes to mind when you hear the following terms? Eclectic. Bit of this, bit of that. A mixture. Yep. No? Integrative then? What's integrative then? Bringing them together. Say more. Okay, that's fine, well done. They're in their whole, more complete. Yep, good. Bringing them together, making them more whole, rather than just bits and pieces. Good. Okay, others agree with that? Does that make sense? So, what do you want to know by the end of this? What is about integrative? Think about it. See whether I've answered your question. Okay. So eclectic is defined as selecting what appears to be best in various doctrines, methods, or styles. Okay, so it's a variety. It's very important for you not to mix these terms up. They are separate terms. They do not mean the same thing. They're not synonymous. Okay? Eclectic is not an integrative approach. Eclectic, a disparity of techniques from many different, often inconsistent theoretical approaches with a little attempt at systematic integration. That's what eclectic is. A disparity of techniques, a whole range of different techniques. So you've got your toolbox, and you've got a spanner and a screwdriver and a 10-pound hammer. And you merely pick out the piece that you think is going to work best for your bit of work. Okay? You don't consider their history, where they've come from. Oh, the empty chair technique from Gestalt, I'll use that. Okay? It sounds like a good idea. But you're not placing it within its history, within its approach, within its use. It feels like a good technique to use. They've got unresolved business with a dead mommy. How are we going to get the dead mommy here? Well, we'll put them in the empty chair. Great, but is it working within the context of everything else? As a technique, utilizing it like that is an eclectic approach. It's often what people say of what works. Eclectic is about what works. It works. Okay? And important to not get too despondent with yourselves if you're choosing the integrative pathway, is you will go through a phase of being eclectic. It's the nature of the journey. You have to get to know different pieces of theories and techniques, and you will use them in a eclectic manner before you integrate them. So to become a fully integrative therapist, you will go through a phase of being eclectic first. Okay, you will be using different bits and pieces, and slowly you'll begin to find an underlying way of integrating these into a meaningful process. So eclectic borrows techniques from a range of therapeutic methods. It's what works. The effectiveness of the treatment modality is what's important, not the intellectual background. They feel that, eclectic therapists feel that the therapy is now being tailored to the patient, client, and not the theory. Okay, they were using what works. So if the patient's got a wound, well, we'll put a bandage on it, or we stitch it up. It works. Yes, but what about the infection? You know, there's different ways of approaching this. So they match techniques from any number of schools to the presenting problem without committing themselves to the theoretical school associated. Okay, so there's no buying in to the approach. It's a skills-based approach. They're choosing the tools from the different models that work, or feels that it will work for them in that moment in therapy. So they use psychoanalysis and behavioral methods while rejecting Freud's ideas or Skinner's theory. Okay, they might not believe in Freud, but they're going to use a word association. But they're working from a person-centered place and then trying to do behavior therapy. Few problems with that person. So what are the implications when you use a bag of techniques without the core theoretical basis? What happens? What are the implications of this? What do you imagine them to be? Get confused? Yep. Yep. You lose the essence of the approach. Yep. What do you think the impact on the client will be when you keep chopping and changing what's been pulled out or being worked with? You might damage them. Yep. They might lose interest. The sessions might feel very techniquey. No consistency. Yes. Okay. There's also, because you're not placing it into a theoretical framework and understanding the approach to using that technique, at what point you would utilize empty chair. You might use it too soon or inappropriately and result in what my professor used to refer to as too deep too soon. And you knock the client into an area where they're not ready to deal with, and you'll have consequences coming out of that, either dropping out of therapy or decompensation of the client, where they become psychotic or distressed to the point that they might need hospitalization. Okay. So it raises the question, if the different techniques do work, what's the use of theory? What's the role of theory? Why do we have theories then? If all these techniques will work, and they do work, what's the role of theory? To understand the context of the work you're working in, yep. When and where to use the techniques, yes. Supplies the method, not just the technique. Method is more than technique. Supplies an overall holding of what's happening for you. So why don't we just do a trial and error, see what works? Yeah. It results in trial and error processes. So, psychological theories as to be more selective. They provide guidelines for which treatment should be considered for any situation or any given patient. Okay, it's a guide. Theories are on organizing principles. Okay, that's why there's core principles to each theory that you need to know and get to understand, because they allow you the criteria and rules so you don't drown in a sea of ill-defined treatment options. Okay, there are rules and grounds of why you select and what you use when you use it. So eclecticism is a conceptual approach that doesn't hold to a single paradigm, set of assumptions, but draws on multiple theories to gain insights and applies different theories to particular cases. And there are many eclectic approaches there. As many as you want to put together in your bag, you can have. Okay? Unique bag of techniques, though. Basis of particular training that people will receive, your case-by-case basis, and there's no general theory or set of principle operating as a guide. Okay? And as I say, this is a process you will go through in your early stages. It's necessary. It's just part of the process. You don't have an integrated theory at this point. So you're going to be grabbing on bits and pieces. And only with time will that integration happen. Being eclectic became a dirty word. If you described yourself as an eclectic therapist after the 90s, it was a dirty word. But there's been a swing back to considering it again, okay, as well. So, by rejecting various theories, the theory in the eclectic stance has been downplayed as well. There is a theoretical basis to an eclectic approach. Egan's skilled helper model is an eclectic model. Some say it's eclectic, others say it's integrative. Something you might need to consider down the line when you look at it. The anything goes approach with little compatibility or orderly integration. So it appears as if there's no integration. It appears haphazard. But there might well be a level of integration that's happening. Okay. So eclecticism is a bag of techniques utilized without consideration for the underlying theories. It's what works in the moment with the client. And that's useful because sometimes we do get stuck and an idea from another theory can help shift us, but it has implications. So, integrative approaches. How many theories do you feel comfortable utilizing to conceptualize clients or to guide intervention? So we've covered some of the main ones. How many of them would you use? Would you feel comfortable in using? Which are your favorites so far? Where are you being left around the different theories that you would use to integrate? So we've covered psychodynamic, we've covered person-centered, we've covered Ellis, we've covered Beck. You'll maybe have covered others with skills. In the skills module, might have been touching on some. Okay. So begin to think about what are your theories that you are using and how are you going to go about integrating them if that's the approach you're going to take. There's a way of thinking about integration as a multi-theoretical approach, as it's like a patchwork quilt. Okay? You choose an individual pieces of cloth, which are your strategies, with different types of fabric, and you are assembling them into a coherent pattern. So each person's integrative quilt will be different, depending on which theories, your pieces of cloth, and how you're sewing them together with your techniques. that you're going to be utilizing, and strategies. So any of you who have done quilting will understand that sort of idea. Okay? There are different ways of integration, different models of integration. The first one is assimilative integration. They choose a core theoretical theory, but use ideas and strategies from other approaches. They favor a firm grounding in a single psychotherapy and incorporate techniques from other theories within their preferred orientation. So I'm person-centered, but I'll use some CBT techniques to get the client to be reflective. So I'll use Socratic questioning, okay, to help them reflect on what they're doing. But my core approach throughout is always person-centered. So you're assimilating. Integrative psychotherapy is a different approach overall to understand the relationship between the different theories. Okay. Oh, sorry, my ear has gone funny on me. Lost my train of thought. Okay. It sounds very similar to the first one. The difference being they are creating an underlying theory to weave them together. They are generating a new theory, in a sense, to create an integrated model. You're creating a new model of treatment or approach. Okay? So, being person-centered and using bits and pieces, and I add them to my toolbox, but I understand that throughout I keep coming back to my person-centered position. I'm not bouncing all over the place. With integrative, I'm utilizing CBT and person-centered and maybe some psychodynamic. I'm bringing the theories together to understand my client better, and I'm formulating a new theory. An example of that would be cognitive analytic therapy. They're using cognitive therapy with analytic therapy based on person-centered principles. Okay, it sounds like a contradiction in terms, but that does exist. It's known as CAT, cognitive analytic therapy, designed to work with borderline personality disorders, particularly within the NHS. Okay, so it's a unifying psychotherapy. They're bringing in different strategies and theories to create a new theory. So there are 5 principles that they use to bring about that integration. And this is, if you're taking the course and doing integrative, that is a very useful textbooks by Brooks Harris to utilize. I think that one might be available on EBSCO now. I haven't checked. It's old enough to be possibly available on EBSCO. The 5 principles. Integrative psychotherapy should be intentional. We'll go through these in detail. Multidimensional, multi-theoretical, strategy-based, relational-based. Okay? So these are the 5 elements. What do you think each of these elements mean for you? What's intentional? What you're focusing on? What you're choosing to utilize? Good. Multidimensional. Different levels, yes. Biopsychosocial is one way of thinking of things as multidimensional. Biological, psychological, and social. Okay. Multi-theoretical, fairly straightforward. Different theories. Strategy-based. Plan, part of it, but also the skills. The strategic skills and what you're going to be utilizing. And relational, fairly straightforward, the relationship. What kind of relational base the theory will have. How do you relate to your client? Okay, so intentional integration. Based on intentional choices, choice of focus, conceptualization, intervention strategies are based on a collaborative dialogue with clients. You know, you're not having this up front. In your dialogue with clients, you're beginning to formulate in your head what's going to work best here. Okay? So intentionality supports ideographic treatment. Ideographic? Personalized to the client. Ideographic. It's a technical term for personalized treatment. Specified to the individual. Yeah? Line counsels to tailor therapy to the individual needs of each client. So it's not a generic, it's not a workbook, manual, because there are manualized therapies where you follow the manual. Session 1, Session 2, Session 3. Yeah? So intentional integration is a middle ground between intuitive and technical integration. Okay? A lot of us work from our gut. You're intuitive, your gut feel. What you feel is right. You work on the client, you're just getting a feeling of, I need to do X. Technical, the manual says, I must do this now. Session 2 in Session 3. Irrespective of where the client's at. Okay, sort of a bit of square hole round peg sometimes. Intentional is trying to balance these two elements. Is collaborative dialogue with clients informed by clinical experience, theory, and research. Because sometimes you'll do stuff in therapy, and if somebody asked you at that exact moment, why did you do that? You might not be able to give an answer. Only on reflection, and that's why it's important in writing notes and reflecting on practice, that you begin to understand the experience and link it to your theory, or link it to skills. Something informed you. It was a body language, it was a moment, it was what I call the zeitgeist of everything coming together that said, I can push this client to a deeper level right now. Or I need to back off. What's the danger of intuitive therapy only? Can be wrong. Yeah, because it's based on clinical wisdom and personal perceptions and your experiences. Based on my experience, well, hang on. Experiences are limited, people, even if you have a lot. So the second principle is multi-dimensional integration. The rich interaction of multiple dimensions in people's lives. Okay, they're coming from a complex environment, and we cannot take into account all that complexity in a single theory. So they have biological, interpersonal, systemic, cultural contexts. There's a whole range of stuff that we will never know what is impacting upon them. So our own personal experiences just don't matter, because we would never have experienced what they are experiencing. So you cannot rely on your own experience to be a good therapist. You have to do the reading. You have to know. You have to have knowledge. And these are the kinds of contexts that you can be faced with. You're dealing with very much like the microcosm of what's happening. Thoughts, feelings, actions. But these are all impacted by interpersonal patterns, social contexts, cultural contexts, the current context in which they're living. Are they homeless? Are they a refugee? Are they coming from a stable family? So this is a multi-dimensional level, and you need to keep those in mind as background when you're working at this microcosm, which is where we work at. But all of these is what I call the symphony in the background. It's the background music that you need to take an attunement to and be aware when it's discordant and not working and doesn't fit. So you utilize diverse theories to understand the clients. multiple conceptualizations can be done depending on where you start, where you end, what you're looking at. Just looking at that, we might, instead of looking at these elements, we might look at the client's problems from a cultural expectation and look at it from a multicultural point of view. How is somebody's problem? It's not so much what they're thinking, feeling, and acting, but they've got cultural integration issues of they don't quite understand the British system. Okay? I know, despite coming from South Africa and speaking English, I still had to learn the British system, particularly the NHS. It has a language and a culture in and of itself, people who've ever worked in there. So you combine different strategies from different theoretical traditions, and it's looking towards integration, emphasizing diversity rather than single approaches. So you're looking at the diversity of the client's experience in your multi-theoretical framework. So you can conceptualize the client across all these theories to get different focal points. So it allows for a very rich and very deep model that you need to think about. Strategy-based interventions or integrations. So you will utilize the pragmatic element. So here is the echo to eclectic. This is where your journey as an eclectic therapist is part of this process. That's what's happening, but you need to begin to weave the theory around it and wrap your methods and your techniques up into a blanket that makes sense. So you can hold your tools in an integrated tool bag. Okay. So you use different theories in a combined level. Key strategies are the skills and techniques that you use, and the strategies are based on usefulness and the likely outcome. And these can be learned, practiced, and implemented with clients. So you're often teaching clients. It's skills-based work. Around this one is you're trying to teach clients skills. So the Egan model, again, is a skills-based approach. Relational. All therapies are based on relationships, so you have to consider that. How are the theories going to determine your therapeutic relationship? Okay. Are you going to be person-centered? Are you going to be psychodynamic and somewhat detached? Are you going to be CBT-ish and be engaged and more directive? For me, those are the three broad relational dynamics that exist in therapy. You have your detached psychodynamic who are reflecting. You got your person-centered who's very warm and compassionate and present but non-directive. And you have your cognitive CBT style directive therapists who are giving the client skills or guiding them to do or engage in particular homework to help their development. So the different theoretical orientations have different theoretical styles. And you need to consider that. Okay? So integrative is not grab-a-bag approach. It's systematic, organized, based on the key concepts. You're thinking it through, you're developing it, and you're building on it. So what are some of the challenges with integrative then? What's the work that goes into being an integrative therapist compared to a CBT therapist? CBT, here it is, here's the manual, this is what you do. Yes, you've got to learn loads of manuals, in a sense. You've got to learn a load of theories. You're not learning one, you're learning, in our pathway, a minimum of two, but probably more, within which the person-centered and psychodynamic, within which you're going to be learning multiple levels and multiple kinds of theories within each of the two approaches. So there's a lot more reading. What else goes with integrating? More time. Okay, more sessions in terms of working with the client might take longer. Yes, you have to think it through. You have to think on your feet. You don't have a clear working approach. Each client is idiographic. Each client is unique. Each client arrives with a set of problems, and you have to devise a model of working with them. So as I've said before, and I think I've said previously, if you are comfortable with not knowing what to do, then integrative is a pathway you can follow. If you are incredibly uncomfortable and cannot handle the anxiety level that not knowing brings, you need to use CBT, because it gives you a clearer structure and a pathway of what you should do. But if you're the kind of client who likes to fly by, or a therapist who likes to fly by the seat of your pants and discover in relation with the client what's going to evolve and how it's going to work, then integrative approaches are very exciting. There's a lot of debate in training around, should students be trained in one school and later they develop whatever they feel like on their own pathway, or should they be exposed to multiple models? There are pros and cons to both ways. Being trained in one school grounds you in a solid approach, so that when you do begin working clients, you at least have one solid grounding. Being trained in multiple approaches means you know a lot, but you're a master of none. Okay? And so you're left feeling quite anxious and on edge when you are working with clients. So if you don't like that feeling, go home to CBT. It's core. It's effective, it works, you know where you stand. So, some of the challenges: to mix incompatible underlying assumptions. How does psychodynamic, and where everything is based on the unconscious, mixed with cognitive, where everything is based on what people are thinking? Okay. Within integrative, don't get then stuck on one model only. You need to be open to a variety of elements. But the most important thing is choose a framework that fits with who you are. Don't choose an orientation that just goes against your grain. That just doesn't fit with how you operate in the world. As I said, my example was finding systemic therapy, and it was like, yes, I've come home. When you find a theory that talks to you in that way, where it goes, yes, I understand this, yes, this is a sense of who I am engaging in the world with other people, then you've come home. You found your approach, and then build upon that approach. So the therapeutic goals in integrative therapy are quite diverse, depending on the theory you're using and depending on the client's expectations and goals. Okay, so compared to CBT, which is a very clear focus, we're focusing on the dysfunctional thinking patterns. These can have any number of goals. You could go back to the multicultural level, contexts, relationships. Any one of those could become intervention points, not just. So there are a variety of roles that are utilized, dependent on who you are and where you're operating from. The roles will vary depending on the model used and where you're working and what kind of clients and what your experience is, and that will evolve over time. As you study and develop, and depending on your placements and where you work, what your life experience is, it will change things. So you need to use the techniques appropriately. There is a process called technical eclecticism by Lazarus, which is a multimodal approach and considered an integrative model, which is like contradiction in terms, an eclectic model that is integrative. So if you're on that pathway, that's the approach, but you are your best technique. Okay? You're the one in the room making the choice of which theory to apply, which theory to use. I used to think of myself as being an integrative, but I'm actually eclectic. Because when I work with a client, I will in my assessment process, I will pick up the core issue or problem and select the appropriate theory to understand that from, and then use that theory's approach with that client. So in one session I might be using CBT. In the next session I could be using attachment. Not with the same client, with a different client. Okay? But with that client where I felt their problems are X, I'll use CBT and I'll stay with CBT. With client 2, their problems are around attachment disorders, I'll work within the attachment model. So I'm very eclectic, not integrative. I have a range of training between systemic, psychodynamic, cognitive behavioral therapy, cognitive therapy. Okay? And I can utilize each one of those as needed in their blocks. I don't integrate them in that sense. I'm an eclectic therapist, been able to work from a range of theoretical orientations. Multi-theoretical, probably, not quite eclectic. Eclectic, the way we're defining it there, is when you're using different techniques in the same session from different models. Yeah, when you mix and match. So I'm a multi-theoretical rather than, it's more accurate, multi-theoretical therapist rather than eclectic. Yeah. Important distinction. Good, well done. Yeah. So if you had to think of this case example, don't know if you can read it at the back. During 5 years of courtship, 2 years of marriage, there have been numerous separations, usually precipitated by his dissatisfaction. Although he and his wife share many interests, and until recently have had a satisfactory sexual relationship, he thinks that his wife is basically a cold and self-centered person who has no real concern about his career or feelings. His dissatisfaction builds up to a point that leads to fights, which often result in temporary separation. He then feels lonely and comes crawling back to her. Their relationship currently is one of icy separateness, and he seems to be seeking support to make a permanent break. He is in extreme distress because of his marital situation. There is no evidence he has difficulties with other interpersonal relationships. He has many good friends and functions well in his job, denies symptoms other than the distress about his marital situation. This is quite a common sort of case that you will get. Yeah? How are you going to approach this? Which theories would inform your case? Which models would work? Which techniques would help you? Okay, so let's start with CBT. Why CBT? How would CBT help? What would CBT address in this? So what would you conceptualize, and what homework would you be giving here, for example? So trying to repair but he's seeking to separate. Possibly. But maybe can you consider reconciliation? Utilizing what are you trying to get him to change? What's the goal in your CBT approach? What would your goal be? Say more? You're on the right sort of path? So there's a pattern that he does. So what is that pattern? What model would inform you about that pattern better? It could be a depression. Yes, so that's one model. You can begin to think about this. Does he have an underlying depression? Right? So let's pick up the pattern again. What's his pattern? Okay. Relational approach, yeah. Yeah. He functions well in his job. He hasn't got other interpersonal problems. So with that information, he has good friends, functions well in his job, doesn't have any, but it's just within the marriage there's a relational tension. Thank you. There's an attachment problem. Okay? He thinks his wife is basically cold and self-centered. Builds up to the fight when he then moves away. Okay? This is the classic anxious, detached relationship crisis. I want closeness, wife is distant. I demand closeness, the wife doesn't give it. Eventually I go, enough, I'm leaving. But invariably goes back. They have a fight. He goes crawling back, and because he can't be separate from her. There's a separation anxiety. So Freud processes developmental stages. There's a separation anxiety element here. So that for me brings in Freud's developmental phases. Yeah. What went wrong there? So you've got a psychodynamic model you can utilize here. You've got the attachment model that you can utilize. The cognitive element, what's he thinking about? Okay, he thinks his wife is basically cold and self-centered. Where is that thinking coming from? What is it based on? What's his evidence for that? So here we've already got 3, 4 different models to understand the same client file. And that's the importance about having different theories. And this is where an integrative approach will give you those multiple levels of understanding. Maybe there is something going on at work where he's in a job where all his mates are single. And there's a bit of pressure coming from there to go out drinking with the boys. I'm just making it up to add in, other elements when you begin to look at the multiple levels. Verse not said here, is there a cross-cultural marriage here that might be at play? And that the distance is got to be more with culture than with personality. I tend to think my daughter-in-law is a really cold, hard-assed woman. She's Japanese. Very formal. Okay? And for me, that's cold and distant. But she's just being herself. She's Japanese. You are formal, and you are refined, and you are respectful. And you are very cut off, and you don't show emotions. Now, when you first meet, it's like, oh my God, what have I done to upset her? It's not. It's a cultural element. Nothing to do with who she is. As a person, once you get through that and you accept it as family, she has a great sense of humor. You can have a good laugh once the language barrier is crossed. Only having German and Japanese is a bit difficult to communicate with. So, you think about the theoretical basis. What kind of techniques could you utilize with this client? Okay, so cognitive techniques, pattern of thinking about what's going on that's leading to the breakup. Why is he thinking that she's cold and distant? A diary, thoughts diary. What happens for him to go crawling back? What is that process? Some behavioral experiments. How else could he address the issue before blowing up? Because he builds a point where it leads to a fight and then he separates, so he explodes. So is there a way he can address this earlier rather than later? Yeah. So you approach it at the very basic level, thinking, feeling, behavior, and context. What's he thinking? What's he feeling? How is he behaving? What is the context? And each one of those gives you information about how you can approach and deal with it. There's a very useful integrative therapy website, the Institute for Integrative Psychotherapy, which is the European base for that. Please go and have a look at it. There are very useful articles like this one, The Process of Integrative Psychotherapy by Erskine Trutman. Okay. These kinds of websites where you have things like an institute of are legitimate to use in your assignments because they are institutes, or they're solidly based. They've got a theoretical and academic rigor and history. It's not Joe Soap's blog. You need to be very careful of which internet sites you utilize in your assignments, people. The ones that are considered to have academic acceptance are things like this NICE, Department of Health, the BBC. Okay, those are elements that are useful, but somebody's general blog isn't. Even though they might have good stuff on it, it's not considered academically rigor because it's not been assessed by peers. This site, anything that goes up would have been assessed by their committee and by peers. There are different levels of information that count. Do you know the levels of information? Levels of information. What do you think is at the top level? What is the number one of academically credible sources? Peer review. Okay. Peer review. Where do you find peer review? So that is where EBSCO is vital. As a body, EBSCO counts as a journal. They are the most relevant and most thorough because it's peer review. I've said, hey, you've all had a look at it and given a comment on it. Yes, we agree with it. No, we don't agree with it. What's the next level down there? Books. Yeah. What kind of books? So academic books. Not the self-help manual. The clear academic literature and theory, the textbooks. Books written by two levels, one, multiple authors, and with an editor, and then secondly by a single author as authority. Something with pedigree. They publish lots of journal articles. They're well respected in their field. Next level down, what do you imagine to be? Put it in broad terms, information that's out in the public domain, but respected. Okay, so that's things like the BBC, newspapers, magazines. Yeah, maybe like Nature or the Psychologist, National Geographic. Newspaper, respected public domain, BBC. Sorry, my handwriting. Not all newspapers, respected newspapers. The Sun is not a respected newspaper. Okay. Respected public domain. Okay. And the bottom of the heap are personal interest type element. That's Joe Blog's website. Wikipedia does get supporting that. You could argue that Wikipedia is in a sense today, but it's not that effective in academic terms. In the public domain, you have respected sites that are recognized. Here you would have professional sites, like the BACP, recognized as the profession's body of information. So the different levels of information, when you go and searching on the internet and you just come across Joe Blogs, it's not going to rank very highly when I'm reading your essay. And you've got simply psychology.com as your reference. Or as one person said, plagiarized essays here. You know, the essay copying business. You can buy your essays out there, people, but we will find out. So don't go by them. Turnitin will discover it and you will be punished. So make sure you are utilizing the right level of information in your assignments where you can. Preferably books and journals. Respected public domain is sort of the bottom line. Anything at this level, don't include. Unless you're using it as an example. Brooks Harris, the useful one to read. So is Susan Cully, Counseling and Action Series, Integrative Therapy. So there's a lot of readings available on integrative approaches, people. EBSCO has thousands. So if you look up there, you will find lots on that. There he is. He's just plain nuts.